Hello and welcome to our summary of the 2016 budget. My name's Frank Quinlan, I'm the CEO of Mental Health Australia, and we're not long out of the budget lock-up over at Treasury and have put together what we hope is a quick summary of our at least initial impressions of the 2016 budget. Overall, there aren't many measures directly affecting mental health, so there aren't many spending measures or new initiatives and so forth that are on a particularly grand scale. There are some small measures that I'll go through in a moment that are welcome investments in mental health. There are also some measures in the budget that we're a bit concerned about because of their potential to impact on people who experience mental illness and their carers. But to get to our summary, on the positive side of the ledger, in the first instance, there's something like $40 million of new investment in veterans' mental health services, which I think we'd all welcome. These include mental health services, suicide prevention programs, and also some investment in the children of people who experience mental illness out of the ADF. So I think they're welcome initiatives, and as I said, on the face of it, new investment. Of course, with any new investments, having those things integrated into our existing programs and services is going to be part of the challenge. Also on the positive side, there's a small investment in an online perinatal depression support service, which we think again is welcome, but it doesn't really make up for the very substantial retraction of the investment in perinatal services that was represented when the state and the states and commonwealths withdrew from the partnership agreement in recent years. So a welcome initiative, but making up for some lost ground really on that front. In terms of the sort of negative impacts that we identify, or potential negative impacts that we identify, one of the very substantial measures in the budget is to cut welfare payments, including DSP and New Start and carers payment. So this occurs because the government are reducing the payments that were due to offset the carbon tax, and are saying now that since the carbon tax no longer exists, the compensation is no longer required. This will only affect new entrants onto these programs, so they're effectively grandfathering people who are already on those payments. They'll receive the higher level, but this could mean something like $12.40 a fortnight for some people, around $8.80 for people who are on New Start allowance. So that has quite a significant impact on people who will be entering into those programs. Also on the DSP, there was an announcement that there'll be 90,000 people over the next 3 years, so 30,000 people a year, brought in for reviews of their eligibility of the DSP. The language in the budget papers said something like people at high risk of non-eligibility. We're not sure quite what that means, but we know that with recent attempts to prevent entry into the DSP, that people who experience mental illness have been overrepresented in those numbers, and something like 60% of the people who lost access to the DSP in the measures announced in last year's budget were people who experienced mental illness. So that's a measure that we'll be watching very closely and hopefully working with DSS to ensure that impact is minimised. There's also a pause in indexation to Medicare benefit schedule, which means that the payments that doctors receive and the payments that allied health professionals receive will not be increasing and are locked at their current rates, which effectively means a cut in those rates given that the costs of providing those services are always going up. So this is something that's likely to, again, adversely affect people who experience mental illness and is likely to affect the services that they're provided. Another area is a freeze on the some of the payments and cutbacks in some of the payments around the flexible funds, the health flexible funds. Now these funds have not been spent directly in mental health areas, but they are spent in areas of prevention and public health, and so we're concerned that any cutbacks in those flexible funds could create problems downstream. A number of other areas that we describe as areas of interest in our summary, and our summary will be available on the website shortly. There is new investment in family violence, something like $100 million over 3 years. That will be an important investment in reducing violence against women and their children. There's also a third action plan for protecting Australia's children, something like a $5 million investment over 4 years in 2-year-old early intervention and prevention trials for vulnerable people. This will mean concentrating on the first 1,000 days of a child's life, and I think we all know everything that we're learning in mental health suggests that that sort of early intervention is going to be very important. There are also a couple of measures that have strange sort of acronym-like names. One of them is called Try, Test and Learn Fund. This is an employment program and an approach to an investment in welfare that will see $96 million invested from 2016-17 in a program that will really be aiming to have innovative approaches to investment that can reduce long-term welfare dependency. So that possibly has some potentially positive impacts in the mental health space if that money's directed the right way. The other is a prepare, trial and hire scheme in employment services. This takes some money out of the Work for the Dole program, which is, I think, a pretty poor program in any case, and reinvests it in a program that will see essentially young people, vulnerable young people, put through a 6-week training program and then placed in internships in organisations and supported over the 6 months of their internship by wage subsidies to the employer and by payments direct to them. So I think, again, this program has considerable potential to be a much more effective sort of welfare to work measure than some of the measures that we've seen in the past. There's also the establishment of what's called a National Disability Insurance Scheme Saving Fund. I'm always cautious about these kinds of saving funds because mostly they're just sort of book entries or accounting measures that don't have a particular substance. But in any case, many of the savings and the efficiencies that are being achieved in some parts of the budget, including some of those measures around the DSP, will be invested in this fund to support the work of the NDIS. We'll look more closely at that over the rollout period. One of the concerns that we would have in that space is that we want to avoid robbing Peter to pay Paul, as it were. So in broad summary, they're the major measures that we can see in the 2016 budget. Our response tonight welcomed the positive measures and expressed caution about the measures that look like cutbacks. Overall, though, I think my broad impression is that what we're really still missing is a national plan to tie all of these reforms together. So we have some very substantial reforms rolling out in the mental health space currently. We have the National Disability Insurance Scheme picking up lots of programs. We have primary health networks taking on new roles and investing in commissioning. And we have the sorts of measures that I've talked about tonight occurring in welfare and in employment and in other places. But we don't yet have a national plan that pins all that together. We don't have a national plan that ties together the various Commonwealth departments, and we don't have a national plan that links the work that's happening in states and territories with the work that the Commonwealth is doing. I think over the course of the election campaign, that will be the major focus of our efforts, ensuring that future investments in mental health are part of an overall plan and ensuring that those investments in mental health are adequate to meet the needs that we have at the moment. And I think there'd be no disagreement that currently the investment in mental health is not substantial enough to meet Australia's need. These are our initial impressions on the budget tonight, fresh out of the lockup. I hope they're useful to you. Keep your eye on our website and we'll get as much information to you as we possibly can as we digest these measures over the next few days. But thanks for your time tonight.